What do you do when your aging parent wants to leave the hospital, the rehab, or nursing home against medical advice, or AMA as it's called? Well, first of all, let me say I get it. I totally get it. This is a super stressful situation. Your parents' well-being is at the very top of your mind. And when they are determined to leave the facility AMA, it could feel like they're putting you right in the middle. Because on one hand, you want to respect their wishes, you want them to be able to make their own decisions, but at the same time, you're worried about their health and their safety. So today we're going to break down exactly what leaving AMA means and how you can navigate this very tricky situation in a way that's best for everyone. Hi there, I'm Sofia. I make videos to help you support your aging parents with the best strategies, information, and resources so you can both have the best outcomes. I am a geriatric social worker with almost 30 years experience working in hospitals, nursing homes, home health care, and health plans. So I know firsthand that when a patient wants to leave the hospital, AMA, the very first thing that they yell on the unit is, "Get the social worker." Because we are specially trained to work with people who are in distress and upset, and also to provide education in a way that people understand. So I've had a lot of experience in this area. So let's start with the basics. What does it mean to leave AMA? Essentially, it means that your parent wants to discharge themselves from a care facility, whether that's an acute hospital, rehab, or a nursing home. They want to discharge themselves before the medical team believes it's safe for them to do so. Now, this can happen for a lot of reasons. Maybe your parent feels like they're not getting any better, or they're getting frustrated with the care that they're receiving, or they had a conflict with the staff. They could be worried about finances related to their hospitalization, or they might simply be scared or confused. Whatever the reason, leaving AMA is a decision that comes with risks for both the patient, your parent, and the facility. When someone leaves AMA, the healthcare team is in a bit of a tricky spot because the doctors, they're not required to write up the regular discharge orders that they would normally, that they'd normally write if a patient leaves under normal circumstances. They're not required to. This means that things like prescriptions for medications, orders for equipment like wheelchairs or hospital beds or walkers, home health services or transportation arrangements, and follow-up appointments may not be provided. The rationale here is that by leaving AMA, your parent is essentially refusing the care plan that the medical team believes is necessary for their recovery. So the healthcare providers might have limited involvement in ensuring a safe transition home. Whether or not orders are going to be written is going to depend on that particular doctor and the policies of that particular facility. Okay, so what are you supposed to do if your parent is dead set on leaving AMA? Here is a step-by-step guide to help you through this challenging process. The very first thing that you should do is request a team meeting as soon as possible. This meeting should include the doctors, the nurses, the social workers, and any other key members of the team that your parent has been working with. The goal here is to have a calm, rational discussion about the risks and the benefits of leaving AMA. It is required that the doctor has this conversation directly with your parent. By bringing everyone in together, you can ensure that your parent has all the information that they need to make an informed decision. And with you there for support, you can help manage the situation before your parents' stress gets higher or their frustration escalates. It is really important to keep the lines of communication open during this time. The more that your parent feels heard and understood, the more likely they are to reconsider leaving AMA. The next thing that you need to pay attention to is to try to get to the bottom of why does your parent want to leave in the first place? Are they scared? Are they worried about finances? Do they feel like there are things at home that need their attention right away? It's important to understand the underlying reasons for their decision, because once you do, you might be able to address their concerns in a way that will make them feel more comfortable about staying in the facility and getting the care they need. For example, if your parent is worried about the medical bills piling up regarding this hospitalization, you can ask the social worker to explain the insurance coverage, or to set up a payment plan, or to explore financial assistance options so your parent will be more comfortable. If your parent is anxious about things that need to be done at home, then maybe you can make arrangements for someone to take care of those tasks so your parent doesn't feel like they need to rush home. If your parent is objecting to certain tests or procedures, make sure that they know they have options to discuss these concerns with their medical team. They don't have to feel like they're being forced into something that they're uncomfortable with. It's okay to say no. Sometimes a compromise can be found that makes both your parent as well as the medical team feel comfortable about moving forward. For example, maybe your parent doesn't want to undergo a particular test or a particular procedure because it's invasive or they don't understand the need for it. The medical team might be able to offer an alternative that's less invasive, or to explain in more detail why that test is important, helping your parent feel more at ease with the situation. If, despite all your efforts, your parent still insists on leaving AMA, it's important to be prepared for what that might mean. As I mentioned earlier, the doctor is not required to provide the full suite of discharge orders, and it will be completely up to them and that particular facility's policies about this. This means that you might have to take on the responsibility of arranging for medications, the equipment that's needed in the home, or follow-up care yourself. It could be a lot to handle if you're not familiar with the system, so it's critical to have a plan in place, because you might need to be the one to contact your parents' primary care physician to get the prescriptions written or to get orders for home health care. But remember that the primary doctor very likely might want to see your parent before they write any orders, and unfortunately sometimes they are booked for a month or two out. Keep in mind that the level of support that you're going to receive can vary depending on the facility's policies and the doctor's mood and disposition and the specific circumstances of your parents' AMA discharge. Finally, it's really important to understand and communicate the risks associated with leaving AMA. Research shows that patients who leave AMA are at higher risk for hospital readmissions and other medical complications, including death, and this is not something to be taken lightly. Also, understand that because Medicare penalizes facilities for readmissions within a certain time frame that are related to the same cause, having your parents sign an AMA document is a way for the facility to protect themselves from financial penalties. But beyond the paperwork, the real concern is your parents' health and safety. Make sure that your parent fully understands that by leaving AMA, they're taking on a greater level of responsibility for their own care. It's not about scaring them, it's about ensuring that they're making an informed decision that they are prepared to live with. And since I did mention scaring them, I'm going to mention this also. You might hear hospital staff say that the hospital bill won't be paid by the insurance if you leave AMA, but there honestly is no evidence that this is true, and they're just using it as a scare tactic, or it's being said by someone who really doesn't know better. The bottom line is if your parent has capacity to make their own decisions, it's your parent's right to leave the hospital or facility if they want to. The hospital is not a jail, and trust me, the staff do not want to feel like prison guards. Now, there is one more thing that I must address. Sometimes, if your parent wants to go home because they're simply tired of all the medical treatments and interventions, and they just want to go home and be comfortable in their own home, it's worth considering a discussion about hospice services. Hospice care focuses on comfort rather than curative or diagnostic treatment, and they can provide a more peaceful and supportive environment for your parent if they're nearing the end of their life and they no longer want medical intervention. This isn't an easy conversation to have, but it's a very important one. Hospice can offer pain management, emotional support, and help with daily activities, all in the familiar surroundings of your parent's home. If you think this might be a better option for your parent, then talk to the doctor or the social worker, and they can guide you through the process of setting up hospice care if it's appropriate, and help ensure that your parents' wishes are honored in a way that provides them with the best quality of life as possible. And the hospice doctor, they're going to write the orders for all the necessary things that your parent will need at home. There is a push to get away from AMA orders altogether, or to at least change the name to BMA, before medical advice, so that it is at least a little less adversarial and more geared towards aligning with what patients want. But they are still working on that one. Navigating this situation, it isn't easy, and it's normal to feel a bit overwhelmed. But remember, you're not alone in this. The healthcare team is there to support you and your parent, and taking these steps can help ensure that your parent makes the best possible decision for their own health and safety. And if things get too complicated, don't hesitate to ask for help, whether it's from the social worker, the patient advocate at the facility, or even legal counsel if necessary. So has your parent ever asked to leave AMA? And if so, tell me about it in the comments and whether you think any of these tips would have been helpful for you. I hope you never have been in this situation and that you never will be. But just in case, I hope this video was helpful. If it was, go ahead and give it a thumbs up, and don't forget to subscribe so you don't miss any new videos on everything parent care related. I thank you so much for watching today. I'll see you next time.